Thanks so much for coming. So a very warm welcome to everybody to the Rural Health Seminar Series. My name's Jo Longman. I'm a Senior Research Fellow based here at the University Centre for Rural Health. We're going to depart from tradition a little bit in that I'm just going to give a very brief introduction, and then I'm going to ask Ange and Dave to do the acknowledgement of country. So the Rural Health Seminar Series is a collaborative venture with the University Centre for Rural Health here, which is part of the University of Sydney, the Northern New South Wales Local Health District and Southern Cross University. Okay, so a bit of housekeeping. So for people who are on the Zoom, can you please keep your microphones muted? The seminar is being recorded and audio recorded, video and audio recorded. We're going to have time for questions at the end today. So if you want to put your questions in the chat for those people online, or you can unmute and ask a question at the end, and we'll obviously take questions from in the room. We've got some roving mics here to help us do that. So just a heads up about the next seminar, which is on the 17th of August. It will be the same time, so 4 o'clock, Thursday, the 17th of August. And that's a presentation by a colleague of ours, Chris Williams. And Chris is going to be talking about what is the role of lifestyle in the management of chronic musculoskeletal pain. Oh, is that not working?
No, you're not sharing the screen.
Sorry, everyone, we're just fixing some technical issues here.
Yeah, did you? It's sharing the video, it's just a bit, yeah, it's on the screen. Computer audio? Yeah, okay.
Thanks. Okay, so on to today's seminar. So it's my great pleasure to introduce our speakers for today. Ange Sheridan is a Wiradjuri woman and Dave Edwards is a Worimi. Both live and work on Wiradjuri Waible country. So they're based here at the UCRH and work in a larger part-time team on the WellMob website project. So the project's part of the National E-Mental Health in Practice, the MPRAC project. So MPRAC is federally funded and it delivers training and content for health and wellbeing workers on using low-intensity digital mental health interventions. So you can learn more about Dave and Ange by having a look at the bios that we sent out with the invite for this seminar today. So with no further ado, I'm going to hand over to you guys for an acknowledgement of country, and then you can start the seminar. Okay, thanks so much.
Thanks, Jo. Wiradjuri, Wiradjuri, hello, welcome. Yeah, Wiradjuri Waible, all right. Here we are on Wiradjuri Waible country. Nyatan Yaran Marung Baragu always was. Pay respects to this land. Nyatan Yaran Marung Dangai Galgu. I pay respect to our ancestors. Wanyibu Ganyila. Always was. Wanyumbo Ganyi. Nirimba, Dangaigu, Arai, Wiradjuri Waible. We pay respect to Wiradjuri Waible country. Kaptania and Ginyang, let's go happy together today. I'm David Edwards, I'm a Worimi man. I would respectfully pay my acknowledgements to country, to countrymen here, countrywomen, our Indigenous staff here at the UCRH and online, our non-Indigenous allies. And Ange Sheridan and I are here today to talk about social and emotional wellbeing and the WellMob website project. And I guess it was important for me to acknowledge country in language given to me by my uncle, Stephen Sheridan. It's the Gatang language of the Worimi Birpai people. And I guess that's part of my well-being. And it's really nice for me to step up and I guess try and use my language to demonstrate how culture is such a big part of my well-being. And that's what our yarn is about today. So thanks for hanging in there with us. we're just going to switch presentations. So just bear with me because we've had a few technical issues already today.
Stop sharing. No,
Do I to change screen? Oh, thank you. New share or just stop share? Okay, thank you. And just bring up my presentation. Thanks very much, Marcel. Okay, and I'll do that first. With sound. Is the little bar supposed to come up? At Zoom. Maybe there. Share screen. Thanks for hanging in there with us. Don't you love the technology? Now, we've still got some issues here. I'll try and get rid of that and share that one. Thanks. I'll get some brains bigger than mine.
that's the one that you want.
Yep.
I set my screen more.
While Tara is doing the tech, thank you, Tara, for stepping in. I'll just go through our outline today. So as the title says, I kind of like cutting to the main part of our title, which is culture is key. Angie and I come up with the deadly subtext, just to sort of bring in new academics and academics and educators and staff. But it's really about our holistic model of social and emotional wellbeing that we proudly embrace as probably a Western systems model. Thank you, Tara. I just might need to change that so our notes pages come up. Sorry, Tara. I'll just go to presentation again. Can you get it so we have a split screen?
Yeah.
So yeah, we're going to touch on the social and emotional wellbeing model, which a lot of people might be familiar with. It's been around probably for 15 odd years, and it's adapted from a First Nations Canadian model. And only Pat Dudgeon, who we collaborate with, and Graham G, come up with the Aboriginal Torres Strait Islander version. And it's really about embracing all the elements of Indigenous wellbeing, and particularly our connection to culture and country and kin and community, which probably differs a little bit from non-Indigenous perspectives around wellbeing. So we're going to talk about that today and use that as a bit of a framework or discussion to sort of see how you might be able to apply that in health service delivery, as well as education activities. And we'll segue into a social emotional wellbeing tool called WellMob, which was actually originated in Bundjalung country. It came out of the idea from Bundjalung Aboriginal health workers. And proudly, University of Centre for Rural Health has co-developed that with other mob across the country to be this country's first digital library of Indigenous specific social and emotional wellbeing tools. Still haven't got there. We'll just keep, stumbling along. Anyway, WellMob's going to be a great way for us to sort of probably show some digital tools or online resources that relate to Indigenous perspectives around social and emotional wellbeing. And we can have a little bit of a yarn. Ange and I are going to sort of try and make this as practical as possible with some tips about using digital social and emotional wellbeing tools, and finish off with a bit of a discussion around some new resource sheets that we've developed, which are shortcuts for workers. We've got 360 odd Indigenous specific wellbeing resources on WellMob. And when we talk about resources, we're talking about apps, videos, podcasts, other websites, PDFs. So we've got 360 odd, and it's very difficult for our time poor workforce to find the hay from the chaff. So we've actually developed some resource sheets around some really specific common topics, everything from cultural identity to anxiety, depression. And we've also developed some sheets around that are for non-Indigenous workforce cultural competencies, stuff around understanding the impacts of colonisation. No, can we? And Ange, do you want to tell him what we want?
Oh, yeah, sorry.
Notes?
Yeah, can we have a look?
And we've tried to make these resource sheets like simple shortcuts for workforce to be able to go to some best practice resources without having to use the search function in WellMob or use the 6 main topic tiles. So that's what we hope to get in today when our PowerPoint presentation works. I think it's easier for me to sort of get the clap sticks out and hold your attention. Okay, well, we had it working before. Just for our audience, we've done a few little dry runs and everything was perfect, but you know, it's all counts on the day. So hopefully you've got a bit of an understanding of what we're going to cover today. And just about Ange and I, who we're based here at the University Centre of Rural Health. We're part of the broader e-mental health in practice, or MPRAC, which sounds like something, a noise your cat would make with a verbal, like MPRAC. So we're part of this national project, which actually is a consortium of several players, and one of them is Black Dog Institute, another is Menzies School of Health Research, the University Centre of Rural Health and University of Sydney, and QUT. So we work in a small part-time team here. I'd like to acknowledge some former colleagues while we're getting our tech ready. Professor James Bennett-Levy, Dr. Judy Singer, Sasha Harrington, Liz Lewis, Honey Darlene, Rodimer, probably a few others that I've left off that list. But it's been a project that's really emanated from here at UCRH. And a big acknowledgement to all the reference groups that were involved across the country in Kaurna country, in Adelaide, in Darwin, Narragansett country, that helped us develop WellMob. We might just go with the presentation, otherwise, and we'll just make up our notes, I think, if that's at this late stage. Oh, all right, I'm just going to put some anxiety. Yeah. Well, if Nate can't handle it, nothing can. What else can I yarn about? I don't have any good jokes, but I guess today, like, also we'd love to have some questions and some discussion at the end around social and emotional wellbeing, because I think it means different things to different people. And as I mentioned before, I kind of think it's a Western systems model to try and explain our unique ways of knowing, being and doing. And but it kind of resonates with me, and it resonates with our project, because it's a simple way to particularly describe or talk to non-Indigenous practitioners about the holistic domains of our health and wellbeing. Thank you, Nath.
Yeah, thank you.
Appreciate that. So I've done enough talking, trying to get through that tech glitch, and I'm going to hand it over to Ange Sheridan, my esteemed colleague, to talk about, we're going to dive straight into SEWB. So thanks, Ange, for helping to problem solve.
No worries. So social and emotional wellbeing is a term that's used to describe our Indigenous overall wellbeing. And it's more than just mental health. It's the way that it accounts for our connection with the world around us. So our self, community, country, culture, kinship systems are interconnected and not separate to another.
And I think that's the important sort of point, is the relational aspect of our well-being, that it relates to our connection to country. You know, my meagre attempt to do acknowledgement of country and language is my attempt to connect to country, and as part of my well-being, as I mentioned before. And so you can see our lovely notes. We've done a lot of preparation for this, other than IT.
No, we actually did a lot of IT and tech prep before this, but it just, as always, doesn't go to plan.
Oh, do you?
Okay, well, that's all right.
Okay, so just look at Ange.
So then the main difference between social and emotional wellbeing and mental health, or the mainstream mental health, is the holistic concept that social and emotional wellbeing has. It's not just symptom focused or issue focused, and it has, I guess, understanding this difference between social and emotional wellbeing and mainstream mental health concept. It helps to address the complex and interrelated determinants of health. So it also recognises a person's It also recognises a person's social and emotional wellbeing is influenced by past policies and past events. So things like invasion and dispossession, stolen wages and payment in tobacco and alcohol, stolen generations, sexual abuse and breakdown of family structure. The SEWB, which is like the abbreviation of social emotional wellbeing, because it's really long to say when you're saying it repetitively. So the SEWB model recognises that these past practices continue to have ramifications and affect Aboriginal and Torres Strait Islander people and communities today. And that can be seen, through how, the differences in education and employment income and access to services, including health and mental health and wellbeing. Hopefully this video will work. But this is a video that is an example of one of the online resources that's found on the WellMob website. It's a really great short video, and it's called The Journey of Health and Wellbeing. It kind of describes and shows the impacts of colonisation on Aboriginal and Torres Strait Islander people. So I will press play and fingers crossed.
Downs, that's normal. Before colonisation, Aboriginal people also had their ups and downs, but overall our spirit was strong. Aboriginal people had a strong culture for tens of thousands of years. When the dominant culture arrived and they took over our land without our permission, the process of dispossession began. The loss of land and disruption to our way of life, ignoring the things most sacred to our culture, including our family kinship systems, language, traditional law, cultural practices, and looking after country. The dispossession brought massacres, poisoning, and disease. We lost our freedom, physical safety, and health, all of which impacted on our well-being. They introduced legislation and policies to assimilate us, with the ultimate aim to breed Aboriginal people out of existence. They even took our children from us.
So that video can be a really useful educative tool around the impacts of colonisation. I could see that video working really well amongst workplaces and schools, even, in training and education packages that you might have amongst your organisations and networks. And it helps us to understand the events of the past and how they play out in the present, while acknowledging our strengths as well. Like, our strengths are why we're still here today, to be honest. And it's those strengths that we really tap into in that social emotional wellbeing model and construct and concept. So it puts into perspective as well why we need Indigenous specific wellbeing website like WellMob that houses these specific Indigenous specific online resources, because social emotional wellbeing underpins everything that us as blackfellas does and everything that we create and present. So for us to have specific content speaks directly to our ways of doing, knowing and being. And we've just watched that video, but that's just one example of one of the resources that's found on the WellMob website. And we'll go through a couple of others later in the presentation as well. So this is the social emotional wellbeing model. It's a framework that's been developed to kind of map out the holistic concept of social and emotional wellbeing. And it's consistent with our Aboriginal and Torres Strait Islander ways of doing, knowing and being, and recognises the significance of culture and history as important factors that inform and guide better healthcare. The term mental health is linked, the term mental health is linked to stigma or negative attitudes towards and beliefs about mental ill health, which we know mental health isn't just that. Social emotional wellbeing includes mental health as a broader, strength-based and multidimensional concept. And this model has been developed as a framework to social and emotional wellbeing. Frameworks are domains and the determinants that affect those domains. So the things that I mentioned before that make up an individual's social and emotional wellbeing, like culture and country and kin, they're all protective factors of health. And the social, political and historical determinants, which are around the outside of the model, they are the things that can affect either by weakening or disrupting those connections. This table is actually an excerpt of one of the resources as well that's on WellMob. And it's come out of the Kimberley Aboriginal Medical Service, and it's called A Welcome Guide to Social and Emotional Wellbeing for Aboriginal and Torres Strait Islander workers, so like community health workers. But it's actually a really great tool that I could see everyone finding really useful, Indigenous and non-Indigenous people who work in social and emotional wellbeing. And I think that when you work with Aboriginal and Torres Strait Islander people in community, you know, it doesn't matter whether you're seeing them as a GP or as an allied health professional, social emotional wellbeing comes into, I feel, that practice regardless of what the issue might be that they're presenting for. Having that holistic knowledge around what might be happening for them at the time as well, and understanding that concept can be really useful in your treatment and in your practice. And this framework, this table kind of steps through those domains. So one of them being connection to family and kinship. So a description of that, it steps through like a description and then the strength in that connection as well as what can disrupt it. So it kind of unpacks it a little bit and what that might look like on the ground and in real life, because this, you know, social emotional wellbeing model as a concept, it can sit there, but then actually to practically unpack that and see what that could look like in your work is another layer that sometimes it can be a bit tricky, especially if you don't have firsthand experience of that. So this kind of helps unpack that. For example, the connection to family and kinship, you know, that includes family and kinship relations, systems of caring, like so respect for elders and caring for other family and extended family. And some of those protective factors is learning family history, sharing experiences with other Aboriginal people, being part of healthy relationships and family connections. But then disruptors or risk factors to that is, you know, removal of children from families, incarceration, family violence, grief and loss, and lack of cultural education. So that's one of the domains. And then, you know, hearing those risk factors, we know what social and political and historical determinants have affected that. Another one is connection to ancestors and spirituality. So for us, you know, that's central to who we are and how we live, and everything we do really is that sort of ancestral connection. It's that intuition almost of how to be, and the teachings that come along with that connection as well. So it includes Indigenous knowledges and belief systems, traditional and cultural healing practices, sacred sites and men and women's business and law grounds, and values of wisdom and hope. That's a description. And then positive protective factors. So accepting traditional and evolving expressions of indigeneity and spirituality that coexist with other religions, and mindfulness practices that enable peace and balance. And a risk factor to that, the impact of mission life, religion, assimilation policies such as stolen generations, and cultural genocide. Symptoms of trauma such as misuse of drugs and alcohol. So from hearing that, we've now got another video, which is another resource that's found on WellMob, and it kind of takes us through, what is it? So
I guess the stolen generations aspect of and how that's impacted by colonisation and the ongoing ramifications of, I guess, segregation and then later assimilation policies, and basically that our children have been removed and continue to be removed from families and the impacts of that. But it sort of finishes on a very light note about how Ange mentioned before, our resilience to get through these traumas and these complex traumas and intergenerational trauma by tapping into our kinship and family systems, our culture, and our sense of connectedness as a community. So yeah, and it's narrated by Uncle Jack Charles. So just a warning of deceased persons audio, and there is permission has been granted by Uncle Jack's family to continue to use this video.
We were able to parent in a cultural way that has seen our family survive and thrive for generations. Our people were strong and our culture flowed and healed us in times of hurt.
But since the trauma of colonisation and the stolen generations, we have not been able to heal in the same way. And we have unknowingly passed this trauma on to our children through sharing our sad stories and having them witness and experience our pain. This is known as intergenerational trauma, and we see symptoms today in broken relationships, disconnected families, violence, suicide, and drug and alcohol abuse.
But this is not where our story ends. We still have strong minds and hearts, and we still know who we were and where we belong. By creating safe and strong communities together, supporting our families to be free from pain, returning to our culture and building a strength of identity, we can stop the cycle of trauma and bring about positive intergenerational change, so that we can continue to thrive for the next 60,000 years. There are simple things that we can always do to help heal our trauma.
Visit healingfoundation.org.au to find out more.
Yeah, I think that video is really powerful in the way that it explains that. And I think, you know, for people who may not have a direct connection to the impacts of the stolen generation, I think that by viewing a video, you're able to gain an extra level of connectedness to it. I think by viewing it as a first person and consuming it that way, you're able to kind of feel it differently to then just learning about it in an education setting or from a rural health seminar. So, but and Uncle Jack Charles, you know, he always had those healing conversations. He always had those really tough conversations around truth telling and healing, and his voice, you know, you heard it. It's just, he's such a presence, and I'm thankful that, you know, his family has given permission for, you know, he's got so many great resources that he's been involved with that, you know, they've given permission for those to still continue even though that he's passed, because I think that gift for the generations going on that still get to hear his voice and hear his stories and all of that, you know, that's part of our healing too. And I don't know, I just feel that real deep.
Yeah, I was going to say, Ange, I guess it's an example of how story's always been part of our journey in Aboriginal Torres Strait Islander cultures, and hearing Uncle Jack's story and how he shared his trials and tribulations, I think it's empowering for our mob, that, you know, despite the adversity of his generation and ongoing, people have risen above it, and, you know, he was prepared to share his story for others to learn from and to heal. So another example of why resources like this are really important to share that journey with non-Indigenous Australians, and particularly in the context of the upcoming Voice to Parliament referendum.
Dave, this is you.
Oh, is it? Yeah. Thanks, Ange. And thanks for persevering with us with all these tech difficulties. So we're going to segue into the WellMob website, which, as I mentioned in the prelude, is this country's first sort of one-stop shop of Indigenous specific social emotional wellbeing resources. As I mentioned, apps, videos, podcasts, websites and PDFs. And it's really designed as a tool, another tool in the dilly bag of our Aboriginal and non-Aboriginal workforce to use with Aboriginal Torres Strait Islander clients and patients. It's also designed for our mob. So we've tried to be all things to all people and have a very user-friendly platform that people can access all the resources that are out there that are to do with social emotional wellbeing in one spot. And basically, it saves, you know, having to go down the Google rabbit warren of trying to find credible resources, and makes it much more accessible for our time-poor workforce. So as I've said there, it's for workforce educators and community. It's really a one-stop shop library of digital resources. And it was developed principally around this model of social emotional wellbeing, because mental health, mainstream mental health websites were so illness orientated and sort of the negative discourse around, you know, issues of substance misuse and anxiety and depression and suicide. We've really tried to tap into a lot of those positive narratives out there through videos, podcasts and other materials that just help, you know, people connect with their culture and wellbeing through their digital space, which I think all of us have learned a lot more about since the pandemic. You know, it was kind of a little bit of important opportunity for us to make people more comfortable and confident of using digital tools, because we all went online and all of a sudden, I guess people who are more reticent to use digital resources had the opportunity to tap into this world of online material to help in their work and with some of the primary healthcare and support for Aboriginal clients. We're going to talk a little bit more about how to use it through some resource sheets a bit later. Angie's got some real practical tips which she's going to share with you about workforce use of WellMob. But before we do, we'll just give this quick video which demonstrates what WellMob is, how to use it, and it's got the beautiful voice of a former team member and UCRH staff member, Taylor Laurie. So thank you, Ange. So let's hope this video works.
WellMob is a website to help our Aboriginal and Torres Strait Islander mob stay mentally strong and feel deadly. It's a digital library of online wellbeing resources made for mob from all over the country. WellMob is developed by and for our mob and brings together the holistic concept of social and emotional wellbeing to build connections to our stories about land, spirituality, and ancestry. Search under the main topics relating to mind, body, mob, culture, keeping safe, and healing. Or go to our training tab for health and wellbeing workers. Whether you're a health or community worker or just one of our mob, the WellMob website is your one-stop shop for digital wellbeing tools. WellMob makes it easy to search for apps, websites, podcasts, documents, social media, and videos that help our wellbeing. And it's not just about mental health. It captures our stories to connect us to country, culture, and our diverse communities. It's that easy. Search WellMob. Watch, listen, and learn about our Indigenous ways of holistic mental health and wellbeing. Go to wellmob.org.au and show your support with a like, follow, and share. These are the homes of ancestral spirits, and WellMob walk lightly with gratitude and respect.
Also have to give credit to Mr. Blake Teddy Rhodes as well for creating that backing track for the video. Always have to credit our creators. So the different ways that you can use WellMob. The WellMob website, it can be used, as we've spoken about, highlighting those videos earlier in the preso, for professional development and cultural awareness. You can use that, the resources on WellMob under the training tab to sort of, I guess, further develop your understanding of those things that go a little bit further than just general cultural awareness training that you might get in your organisational workplace. And for Aboriginal health and community workers, because the content is Aboriginal specific, the resources on WellMob can be used for our own self-care as well, which is really important given the added stresses of lived experience when you're mob working with mob and living and working in community. So that's a really important point as well. And then the other way that you can use it is in like counselling or client-based face-to-face roles and health promotion work within the community. So there's a couple of key steps or key considerations, I guess, in using digital mental health tools with clients in face-to-face client-based roles. So I guess the first one that you would consider is how often do you see your client? So, you know, when you're thinking about using digital mental health tools with them, you think about how often do you see them? How long is your consult with them? What is that time frame, or what does that contact look like? And what type of resource would probably work best in that situation? And also recommending spending some time yourself going through the website to get familiar with the resources that are on there to find the right resource for your client, doing that bit of preparation work. But we have also, as Dave said, created resource sheets, which are shortcuts, which we'll talk about in a minute, which kind of take a bit of that background work out for workers as well, because we acknowledge that we're all, you know, under the pump and time poor. So then I guess it's asking and assessing in session with your client, having a yarn with them, and in that rapport building phase, you know, asking them about what type of technology do they use and what do they have access to Do they have a mobile phone? Is it a computer? Is it a shared device? And I think when we are working in roles that have risk factors of safety, you know, with family and that kind of stuff, that's an important consideration as well. And do they have regular internet connectivity, or are they accessing Wi-Fi? If they don't have internet, you know, you can always recommend them accessing Wi-Fi at like the public library or Macca's. Like I see all the teenagers up there at McDonald's tapping into their Wi-Fi all the time. And accessing it that way, they probably think about it and are quite resourceful for their own personal use. But then when it comes to something that might be a recommendation from their worker, that's a, you know, a positive wellbeing tool, they may not be as resourceful, but just, you know, giving some of those tips as well. And thinking about health literacy. So for people who may have a lower literacy or health literacy level, resources like videos and narrative-based videos and tech resources can be a really great tool to convey those messages rather than potentially a fact sheet or something like that. Having a go and searching the website, searching for resources with your client or in your own time. So, you know, you can take your client through the website, show them how to find the resource. There's also a function when you get to the resource to be able to email it to them as well. But sort of taking them through the website and showing them how to find the resource might make them more inclined later on to go back in and have a look at what else is there as well. And match the right resource to your client and to the situation. So taking, you know, some of those considerations that I've said, taking some of that into consideration and trying to find the right resource for your client and the issues that they might be facing, and use and share it. So as I said, you can email it to them or you can write it down. They might be able to download it in session and come back and look at it later on. And then when you see them next time, you know, check back in with them and evaluate and, you know, ask them questions like, how did you find it? And did it work for you? What resonated? What didn't? What did you like about it? What didn't you like about it? That kind of stuff. And that kind of then, I guess, can lead you into finding either other resources that are similar or things that are different if it didn't work.
And then your example of young people like tapping into Wi-Fi at Macca's, it made me think about social media, you know, how it can be such a powerful tool. Like we hear all the negatives about social media and our young people spending too much screen time, but we've tried to feature some positive social media sites and particularly stuff around expressions of culture on some really good social media channels. And Ange does an amazing job, a plug for Ange on our WellMob Facebook and Instagram accounts, just trying to really put out there some useful tips and guides for our practitioners and workers, but also for our community, acknowledging some of our important days and dates, and just also putting in, you know, some positive stories around connecting to culture and your well-being. So it's really important, I think, to acknowledge the power of social media. We thought we'd just feature one example of an online resource found on WellMob, and we thought this particular app, which is called Stay Strong and was developed by Menzies School of Health Research, was really useful because it can be used across lots of different primary healthcare and wellbeing support roles. It's pretty much a strength-based goal setting tool. And the real benefit of Stay Strong is that it started off in I think Alice Springs in Central Australia as a paper version for non-Indigenous counsellors to build rapport and get engagement with their Indigenous clients. And it's been turned into a very user-friendly app. It's easy to use. It's got cyber safety built into it. Like Andrew said with the WellMob website about sharing resources through the website, the practitioner can share the goal setting plan with the client by just pressing a button. What we would like to sort of really put across about the Stay Strong app is that it's, I guess, been vetted through randomized controlled trials and talking with Mob a lot to make sure it is culturally safe and culturally embedded. And just to give you a quick overview of how it's used, it's pretty much a 4-step process. So it's a pictorial guide through a yarn between a health worker and someone from the mob. And the 4 questions about who keeps you strong. So you map out aunties, uncles, peers, etc. What keeps you strong? There's a whole heap of visual prompts about, you know, cultural protective factors, you know, sport and recreation, meditation and connecting with spirituality. Your worries, So you don't get into the sort of issues until a bit later on, until you've unpacked some of the protective factors. So that's everything from, you know, substance misuse, bullying, racism, those types of things. And then finally, you start looking at drafting some goals. And so those 4 steps can be undertaken over a number of sessions for a practitioner working with a young person or an adult, or it can be used. We've heard Aboriginal Medical Services using it as an intake tool. It was a great way to get a snapshot of how that person's travelling and what their goals are. You know, we all know we need to ask first. We can't assume. So a big plug for the Stay Strong app, and there's a youth adapted version that's being trialled at the moment, which is more of a self-management tool. So you can look at the Menzies School of Health research website to have a look at that particular version. So another example of using digital social emotional wellbeing tools can be just quickly shown through this little montage of some of our deadly health workers out there, both Indigenous and non-Indigenous, that have used WellMob in different settings, from GP and allied health through to, you know, coalface community social emotional wellbeing workers. So I'll let the video do the talking, but these videos are actually on the landing page of WellMob. So you'll see a banner down the bottom there that says tips from workers. And there's 5 videos there from various roles talking about how they use WellMob, but I'll let the video do the talking.
Use WellMob to show people a video that's relevant to their situation, to find a fact sheet and print it out, or even better, email them the fact sheet, which you can do directly from the WellMob site.
The one that I use most for my patients would be the women's part of the website. I really like that there's access to the Facebook group for the women, that there's stuff to do with trauma, which is really important, especially for my women who are pregnant.
And you have a look on the website, there are some great topic areas that you can start to explore and look around with these resources in mind. Mental health, worries, suicide and self-harm, gambling, eating disorders.
I use the tiles more often than not for, you know, the particular thing that I'm searching, and then go from there. And I've found that's the easiest way for patients as well.
People are really smart and actually want to find out information for themselves, and are able to do that with WellMob.
On the website, they're all categorised. There's great search functions, so it's pretty quick and pretty effective way to find Indigenous resources for the person to be working with.
There's so many amazing resources on there in one spot that you won't even have to think about it. You will literally be able to provide your patient with quality, culturally appropriate care, and they will be so grateful for it.
So they're just a couple of health and community workers that have been using WellMob in their practice, that are just sharing their experience of using it. There we go. So that brings us to the resource sheets that we mentioned just before. So rather than searching through, I guess WellMob was initially created because to save time searching through the World Wide Web for all of these amazing resources, we've put them into one place. Now we've got over 360 Indigenous specific and culturally safe social and emotional wellbeing resources housed on WellMob. It's now getting a little trickier to find, you know, the best resources to be able to use with your clients, either in session or to recommend to them or to use in health promotion work. So we've created or developed these resource sheets on a range of common wellbeing issues. And what they are is essentially they're the top pick of resources that are on WellMob for that issue. So they are a interactive PDF. The picture is what it looks like on the landing page of the website. Sorry, not the landing page, but the resource sheet page of the website. And when you click on a resource sheet, it'll bring up the PDF. You can click on a direct resource from there that will take you directly to the WellMob website to be able to open it up and view the resource. So it really is a shortcut. We essentially created WellMob to be a shortcut to the resources. Now we've created another shortcut to use these resources to make it even easier to use in practice. And they've got ones on there. So like anxiety, suicide prevention, cultural identity is broken up into 3 kind of cohorts. We've got adults and young people, and then children, really acknowledging that the needs of strengthening cultural identity look different at those different points of our, journeys. Parenting, and then we've got worker resource sheets. So understanding the impacts of colonisation, which the videos you viewed earlier feature on. Understanding trauma and trauma-informed care. There are some really great resources about that. And then understanding social and emotional wellbeing, what we've been talking about today. So there is a whole bunch of other resources than what we've shown you today, listed on this resource sheet that you can go and have a look at yourself if you wanted to learn more about it, or go back and have a look at, the full length of some of these videos that we showed you today. But yeah, they're essentially another tool for workers to be able to use WellMob and digital mental health tools in practice.
Might be good to mention the overview sheet.
Oh yeah, so there's an overview sheet, which is kind of like an index. I had them printed at the front, and for everyone that's on Zoom, it's also on the WellMob website under the resource sheets page as well. And it just has listed all of the resource sheets that you can, they're all hyperlinked. So you can click on it, it'll take you to the individual resource sheet. Then when you click on the resources on the resource sheet, it'll take you straight to the resource as well. So it's kind of makes it a lot easier to be able to find these top pick of resources that are on WellMob.
So we've gone from 360 resources to 17 resource sheets on 15 topics.
Yeah.
So hopefully our time poor workforce can quickly go to a shortcut and get some credible best practice resources.
Yeah. And, WellMob's already kind of taken that guesswork out of, vetting the resources, so that when you look at them on WellMob, you know that they're already, culturally appropriate, and they've been vetted by an Aboriginal work team at WellMob. So, we've already sort of taken that hard work out of it for you, because I can imagine, it's always a little bit tricky, like, oh, I don't know, is this one okay? I don't know if it's, going to be appropriate or not, but we've kind of taken that guesswork out as well. Next one.
Yeah, let's wrap up.
All right, so recap. Thank you everyone for bearing with us with the tech issues, and for the guys on Zoom as well. So who it's for, who WellMob is for, it's for frontline health and community workers and clients, which is Aboriginal and Torres Strait Islander community people. What it is, it's an online library of social and emotional wellbeing resources. And you can find it at www.wellmob.org.au. And for more info, there's Dave's email address there. You can email him, or there's also the contact form on the website as well. But we're here at the UCRH, so you can feel free to email us as well. And to stay connected, as Dave said, we've got a really big social media presence, which is my job. And we do regular posting where we sort of give lots of insights and tips into using digital mental health tools in practice for workers, and highlighting new resources that have been recently uploaded to the website. So we're on Facebook and Instagram. And we also write a monthly blog for the eMental Health in Practice website, which just further extends those insights into using digital tools in practice. You can also subscribe to our e-newsletter, and that is our team email address if you didn't want to email Dave.
And just a plug for Ange writes all the blogs for the eMental Health and Practice website to do with Indigenous wellbeing, and Ange has got some really good content on there, one of which is around social emotional wellbeing. So go to emhprac.org.au and go to the blogs, and you'll see some of that content. And it's actually surprising. Well, it's not surprising to me, but it's the most through the analytics for the MPRAC website. It's the most read blog. So Ange has been doing some great content. And another little plug, Ange has done a podcast with a Aboriginal health worker from over in the drug and alcohol area of LHD North Coast. So that'll be uploaded maybe next week or within the next couple of weeks.
Yeah, at the end of the month. So eMental Health in Practice and MPRAC have got their own podcast series, and we did an episode with them. It was my first time doing it, but it turned out really good. So I'm excited to hear it and listen to it. And we talk about the cultural and historical considerations that you sort of need to understand when working with Indigenous clients. So
And we've also got some material on Spotify, which I only found out about today. So that's probably wraps us up. So I'm not sure, Joe, if there's any chat there, but I'd like to maybe hand it over to the good people that have made the effort to come out here first. And just if there's any questions, comments, other resources that you think we should be across or other projects, please over to the floor.
yeah. Oh,
Yeah, we'll grab a mic so the people in Zoom land can hear you. Just hold your question. Yeah, I'm not sure if those external mics are working. That's all.
First of all, this just blows me away. It's incredible. Like so much work, and it's amazing. It's very useful, I'm sure too. So I'm wondering, in 2020, as you would probably know, that Joe Longman and Matthews and Bennett Levy, etc., found out that amongst Aboriginal respondents in their research that those who had greater social media engagement had lower levels of distress and PTSD. And I'm wondering, did that have any connection to this project, or did this predate it? And sort of second part of the question is there some plan you have for this around the fact that we're in this region, there's lots of regions, disaster prone regions, and so like how's this kind of relate and integrate into disaster recovery work and that sort of thing?
yeah.
Do you want to talk about the social media presence? I mean, there was definitely no, like connection with that particular work. But I guess, as we talked about before, like culture is a protective factor for Indigenous health, social media can be too. And particularly those culturally responsive sites and accounts that are for and by our mob. And we've tried to feature some of those on WellMob. In terms of disaster recovery, no, we don't have any specific content other than what Joe and others have worked on. It's something we did actually put in for funding for in partnership with the Koori Mail to do a positive social media campaign during the flood and after the flood, then during that recovery. Unfortunately, we didn't get traction with that, but that was the whole idea, to do a few posts a week that talk about what you can do to keep well in this really trying time. So there's heaps of other examples of that out there. But nothing specifically in the disaster recovery for Aboriginal Torres Strait Islander people that I'm aware of. Yeah. Anything else to add to that, Ange, just about social media and?
I mean, not hearing that, I don't find it surprising because I guess, as we've sort of said too, part of our social emotional wellbeing is being and feeling connected. And I think when we don't have that like the pandemic was a great example where we couldn't have that face-to-face or interpersonal contact. Those online platforms were a really effective source of communication and connectedness. And so I don't find that surprising, but it's good that they did a research paper on it.
We've probably only got time for like one short question with 3 minutes left. Is there anything on the chat that's come up, Joe, or was there anyone? No, nothing on.
It's more a comment, so this question.
Yeah.
I was just in response to the earlier comment that you've made around those videos, maybe being good in the workplace. We did at Social Futures, we've shown that full 10-minute video about that journey towards health and wellbeing, and it was actually so powerful, and we just keep getting really good feedback around it. It really has made such a difference to so many people. So I'm really glad that there's sort of all these resources are together. It's super exciting. It was such a great presentation. So thank you so much.
Oh, thank you.
Thank you. And we appreciate everyone sticking in there with those initial tech problems. Hopefully it was worth waiting for. Any final closing comments before we?
I have one comment
from
the chat.
Yep.
So from Carmel Moore, we have absolutely amazing, looks so fabulous and useful for everyone. Thanks so much for an awesome job. Michelle Jack has said, thank you, excellent work. You've mentioned some resources specific for children and youth. Do you have a shortcut or fact sheet for resources for specific age groups?
Some of them, yeah. Like as Ange mentioned, cultural identity, we have a sheet for both young people, so let's say youth, as well as children. And I think we've also got under depression some resources around for men specifically and possibly women. Is there anything else that comes to mind?
I was just thinking about the resource sheet that is for suicide prevention. So there's 2 of those. And one is for, you know, the individual that might be having suicide ideation. And then the other is for the families and communities that are supporting those people as well. So there's different resources for those 2 different groups that are targeted for, you know, that need. That's probably there's young people in there too.
Yeah, and there's a few other cohorts that we've tried to pull specific resources together for our gender diverse LGBTQA plus mob, as well as stuff for our parents. So, and we're hoping to do some sheets specifically for our elders, some resources around elders, and yeah, particularly given our recent NAIDOC week theme.
We've just got 2 more comments in here. One from Vicky Flood saying, thank you, Dave and Ange, terrific work. And Jeff Morgan, congrats, great work. So
cool.
Right.
Thank you.
Thanks, everybody.
Thank you.
Thanks. That just turns off the Zoom, does it? Okay, thanks. Well,
We're still on. Thanks for the chat.
thanks for coming. Thanks for coming.